All right, today we're diving deep into advanced heart failure. And look, this isn't just about a heart that's a bit weaker. We're talking about a condition that really pushes the limits of what medicine can do. We're going to explore the whole arsenal of treatments, from the simplest lifestyle tweaks all the way to AI that can predict the future, giving patients brand new hope. So that brings us to the big question, right? It's one of the most fundamental questions in all of medicine. When the engine of the body starts to sputter and fail, what do you do? Well, as we're about to see, the answer isn't just one pill or one operation. It's a really complex and constantly evolving strategy. The way to think about it is it's a journey. It's a whole spectrum of care that escalates step by step, starting with things you can do at home and leading all the way to futuristic AI-powered medicine. So let's walk through that journey together.
Now, our journey doesn't actually begin with a treatment. It begins with a diagnosis. And when it comes to heart failure, believe me, timing is absolutely everything. Catching it early can completely change a patient's entire life story.
This quote from Dr. Spencer at the Mayo Clinic really nails it. He uses this clinical term, decompensate, which is basically a doctor's way of saying things can go downhill, and they can go downhill fast. That's why spotting the signs and getting other health issues, like diabetes or weight, under control is so incredibly important. It keeps all the future treatment options on the table. Okay, so once heart failure is on the radar, where do doctors even begin? Well, they start by building a really strong foundation. This is the first line of defense, and it's for every single patient. It's a combination of personal habits and some pretty powerful medications. You know, before a single prescription gets written, two really simple rules can have a huge effect. First, limiting sodium. That's a big one, because salt makes your body hold on to water, and all that extra water means more blood volume, forcing the heart to work way harder. And right alongside that is restricting fluids. It directly reduces the strain on that already struggling pump. It's a powerful 1-2 punch that puts a lot of control right back in the patient's hand. Now, let's talk about the medical side of that foundation. Cardiologists have this proven, gold standard playbook. It's called Guideline-Directed Medical Therapy, or GDMT for short. And this isn't just one drug. Think of it as a powerful cocktail of different medications, each one designed to support the heart in a slightly different way. So, what's actually in this medical toolkit? Well, it's a multi-pronged attack. You've got things like beta blockers, which act kind of like a governor on an engine, slowing the heart rate down to reduce its workload. Then there are ACE inhibitors, which relax blood vessels to lower blood pressure. And you've got newer drugs, like SGLT2 inhibitors, that help the body get rid of excess fluid and sugar. When you put them all together, they create this protective shield around the heart, helping it work so much more efficiently. So here's the crucial turning point. GDMT is the foundation, but what happens if it's just not enough? Or what if a patient can't handle the side effects? Dr. Goswami makes it really clear. That's not a dead end. Instead, it's a critical signpost. It's a trigger that says, okay, time to escalate care and call in the specialists. And this is where the journey takes a really fascinating turn, right into the world of high-tech medical devices. When the medications just can't do the job on their own anymore, doctors can turn to these incredibly sophisticated machines that act as a bridge, maybe a bridge to recovery or a bridge to the ultimate fix, a new heart. So this mechanical support really comes in two main flavors. For long-term help, there's a device called an LVAD. It's surgically implanted to help take over the heart's pumping work, sometimes for months or even years. But for more short-term situations, there's a temporary pump, like the Impella 5.5. It works as a bridge, giving the heart a much-needed chance to rest and recover, and hopefully get a patient in better shape before a transplant. For the absolute most critically ill patients, there's a machine called ECMO. Honestly, the best way to think of it is like a pit stop for the heart and lungs in the middle of a race. The body's engine gets a complete break, while this external machine does all the vital work of cleaning and oxygenating the blood. This gives the organs time to rest, to heal, and to get ready for whatever comes next. For so many patients with end-stage heart failure, a transplant is the ultimate goal. But the biggest problem has always been the same: a severe shortage of donor organs. But that's starting to change. Incredible new technologies are expanding that pool of available hearts and are completely reimagining what's possible.
10 degrees Celsius. Now, what on earth could this number have to do with heart transplantation? It seems so random, but it actually represents a massive leap forward.
And here's why that number is such a game changer. For the longest time, donor hearts were just packed on ice. The problem is that can actually damage the heart tissue, and it limits transport time to just a few hours. But with new technology, they can keep the heart at a constant, perfectly controlled 10 degrees Celsius. This extends its life significantly. It means a heart from a donor hundreds of miles away is now a real possibility, which just blows the whole network wide open and gives so many more people a chance at life. Here's another one that's changing everything: normothermic regional perfusion, or NRP. And don't let the name intimidate you. Normothermic just means normal body temperature. This technique basically lets surgeons test drive a donor heart. They can restore warm, oxygenated blood flow to it before it's ever removed from the donor. This gives them a crystal clear picture of the organ's health, making sure only the best, most viable hearts are used for transplants, and that seriously boosts success rates. Okay, it's truly remarkable. Some patients have immune systems that are so reactive, they would immediately attack a new heart. But get this, the liver is the factory that produces a lot of those immune cells. So by transplanting the donor's liver first, surgeons can essentially reprogram the patient's entire immune system to accept the new heart. It's an unbelievable strategy that opens the door to transplants for a whole group of patients who never had a shot before.
So we've gone through lifestyle changes, powerful meds, incredible machines, and groundbreaking transplant tech. The final stage of our journey looks directly to the future. A future where artificial intelligence is becoming a cardiologist's indispensable co-pilot. Hey, remember that Impella 5.5 device we talked about, the temporary pump? Well, AI is already being used with those patients. Machine learning algorithms are crunching massive amounts of data, things like ultrasound images and pressure readings, and they're starting to predict which patients' hearts might actually recover on their own. It's personalizing the huge decision of when it's time to move toward a transplant.
And its role is just going to get bigger. AI is getting ready to help doctors detect heart failure earlier than ever, more accurately figure out a patient's specific risk level, and then create treatment plans that are tailored just for them. We're moving away from a one-size-fits-all approach and toward truly individualized medicine. And this final quote from Dr. Goswami just captures the excitement perfectly. Look, it's not about replacing doctors, it's about empowering them. AI is helping to shape a whole new paradigm, a totally new way of thinking about and treating this incredibly complex disease, all to get better results for the sickest patients. From a simple salt shaker all the way to a complex algorithm, the fight against heart failure is just an amazing testament to human ingenuity. And it leaves us with a really provocative thought. In the future, when it comes to saving a life, will the most powerful tool in the room belong to the human or to the code they created?